It's never been easier to get the COVID-19 vaccine here in Thunder Bay. The district health unit has completely switched to walk-in appointments rather than online bookings. Meanwhile, the district's medical officer of health feels the region is now past the peak of the Omicron wave, but case counts are still dropping more slowly than she'd like. Corey Nordstrom explains.
Getting immunized against COVID-19 for all ages no longer requires an appointment at the CLE clinics. About 57% of adults in the Thunder Bay district have now received a booster shot, which Dr. Janet DeMille hopes can improve with the walk-in format, something they couldn't do when they were busier.
Now our numbers in terms of appointments are much less, and we are basically opening it up for anybody who's eligible for a vaccine to come forward and get one. We have found in the past that when we make walk-ins available, it does make it easier for people.
The Northwestern Health Unit has stated that it will soon reduce the number of large vaccination clinics it runs. DeMille says that is not the case here in Thunder Bay, and the vaccination sites will run until it is no longer necessary, even though more targeted clinics are on the horizon.
Looking in particular to areas where they may have had trouble accessing vaccine and just essentially bringing the vaccine to them rather than having them come to our clinic.
Using a number of metrics, the health unit has narrowed down the peak of the local Omicron wave to the end of the second week in January. But there hasn't been much of a drop in the level of COVID infections since that time.
It doesn't feel like we're fully into recovering from this current surge. We're not at the peak that we were once at, but we still are experiencing a substantial number of cases and outbreaks as well. And certainly we see how this is manifesting in the hospitals.
Corey Nordstrom, TBT News.